Today I'm going to talk about the optic nerve. Basically, the optic nerve is the second cranial nerve. Um, it is purely sensory. Out of the 12 cranial nerves, the cranial nerves can be sensory, they can be motor, as well as mixed. Mixed nerves contain sensory plus motor fibers. So the optic nerve is basically responsible for carrying the sensations, uh, uh, which are sensations from the stimulus of light, and basically they carry those sensations to the visual center of the cerebral cortex, and basically they originate from the ganglionic layer of the retina. The optic nerve fibers, the axon terminals, actually originate from the ganglionic layer of the retina, and then they converge on the optic disc, and at a distance of about 3 to 4 millimeters, travel towards the optic canal. They first converge on the optic disc, and 3 to 4 uh, millimeter to the nasal side towards the nose. The nasal side is basically located medially to the occipital fossa, nasal side of the center of the optic nerve. This is the relation, and it's in the retina. And these nerve fibers are myelinated by oligodendrocytes, which are basically the myelinating cells in the central nervous system, and they myelinate cranial the op- the cranial nerve to nerve fibers or axons. By cranial nerve 2, I'm referring to the optic nerve, and as soon as it leaves the optic canal, it goes into the um, it forms the optic chiasm, which is present in the shallow part of the medial cranial fossa. Optic chiasma, is present in the medial cranial fossa, and the optic nerve fibers travel via the optic canal I've mentioned before. So the optic chiasma is the point where the fibers from the contralateral part of the eye actually pass over one another, especially their nasal fibers. And whereas the temporal fibers, the lateral fibers of the optic nerve, are basically present laterally towards the temporal bone. So let me show you in a diagram. You can see in this diagram that the nasal fibers are passing medially, and they decussate or pass over one another and form a chiasma, and basically the temporal fibers are passing from the ipsilateral side in the chiasm tract, and they are passing on the same side basically, and they will supply on the same side, whereas the nasal fibers will supply contralaterally the senses of vision. So now coming back from the optic canal, the optic chiasma has an anterolateral part and a posterolateral part. So basically the importance of this anterolateral and posterolateral part is that the anterolateral parts basically contain fibers that are continuous with the optic nerves, And the posterolateral part contains fibers that form the optic tracts posteriorly. So, um, in the chiasma, basically the fibers of the retina as well as macula pass through, and their uh, nasal fibers cross over. So, what is the macula? The macula is basically the functional part, the part that senses vision in the retina. It is the functional part of the retina, in short words. So now, posterior to the optic chiasm, we have the optic tract. Okay, and the optic tract basically passes posterolaterally to the cerebral peduncles. Posterolaterally, and after that, it passes to the the fibers pass to the lateral geniculate body, which contains nuclei, and the optic fibers synapse there. What is the lateral genicular body? It is basically an extension, the dorsal lateral extension of the thalamus. Extension of the thalamus. And another important point is that a few of the fibers of the optic chiasma or the optic tract, they do not pass to the dorsolateral extension of the thalamus or the lateral genicular body. They also pass towards the pretectal nucleus of the basically the pretectal nucleus is present in the superior colliculus of the midbrain. Of the midbrain. So, and it is concerned with reflexes there. The fibers passing there are the reason of most visual reflexes. So after that, mm, so another important point is of the lateral geniculate body is that it is it is an oval swelling projection from the pulvinar of the nucleus. Body is projecting part of the pulvinar of the nucleus, and new fibers emerging from there form the optic radiation. After the fibers have synapsed in the what lateral geniculate body, they form the uh, optic radiations. Optic radiations. So the optic radiations basically diverge, and they pass posteriorly to the lateral geniculate body. No, no, sorry, not the lateral geniculate body. Basically, they pass posteriorly to the retrolenticular part of the internal capsule. the internal capsule is actually a network of white myelinated neurons, and it separates the basal ganglia from the retrolenticular part of the internal capsule. Basically separates the lentiform nucleus present laterally from the basal ganglia. I will make a separate video on the basal ganglia, but for now we only know that the retrolenticular part of the internal capsule um, separates the basal ganglia from the lentiform nucleus. And over here, the fibers passing from the lateral genicular body form optic radiations that pass posteriorly to the retrolenticular part of the internal capsule. White fiber capsule. So the fibers from the optic radiations synapse in the Brodmann regions 17, which is known as the visual cortex, and the Brodmann regions 18 and 19 are known as the visual association cortex. And some of the fibers of the optic radiation also terminate over here. Visual association cortex. And these basically, the cerebral cortex, as you know, is divided into many Brodmann areas on the basis of its histological features and the types of cells it contains of the cerebral cortex. So these are Brodmann areas 17, 18 and 19, which are related to the vision. And the visual association cortex is basically responsible for the recognition of objects as well as perception of color. So now coming to the visual pathway, and we will discuss the nerve fibers that are present in this pathway, the neurons, the type of neurons that are present in this pathway, as well as the binocular vision neurons. So first of all, we are going to start off with the receptor cells, which are known as the rods and cones cells, which are present in the retina, and they contain receptors for light. They detect the intensity of light. And then we have bipolar neurons, which connect these rod and cone cells to the ganglion cells. Connect rod and cone cells to the ganglion cells. Then the ganglion cells okay, and another important point I have to tell you related to the cerebral cortex, I forgot to tell you, is that this cerebral cortex is containing the Brodmann regions 17, 18 and 19 is present at the lips of the calcarine sulcus. Present near or at the lips of the calcarine sulcus. What is the calcarine sulcus? Basically, it is a depression that is present in the posteromedial part of the occipital lobe of the brain. So coming back to the visual pathway, we have the ganglion cells. The ganglion cells have axons that pass to the lateral geniculate body. Axons passing to the lateral geniculate body. And from the lateral geniculate body, the axons pass to the cerebral cortex. Cerebral cortex. Now we will discuss binocular vision. So we have to keep in mind the left and right fields of vision, binocular vision. So right and left fields of vision. Okay, so okay, these fields are projected at two parts of on both portions of the retina, projected on retina of the both left and right eye, projected on retinae. Okay, now for example, let me show you a diagram. If we discuss the right field of vision, we see that the nasal fibers of the right side of the retina, as well as the temporal fibers of the left side of the retina, are involved in are involved in detecting the right field of vision. And now if we talk about the left side, the left field of vision, it becomes opposite. The nasal fibers of the left side, as well as the temporal fibers of the right side, are responsible for detecting the left field of vision. So basically, these fields of vision pass through the same pathway via the optic chiasma towards the lateral geniculate body, and then they pass towards the um, cerebral cortex, and the nasal fibers pass towards the cerebral cortex in a contralateral fashion, whereas the temporal fibers of pass ipsilaterally um, towards the visual cortex. And vision of the temporal vision coming from the temporal fibers is on the same side, and the nasal and the vision detected by the nasal fibers can be determined contralaterally by the cerebral cortex. And and so the lower retinal quadrants, or the upper field of vision, project on the lower wall of the calcarine sulcus. So the vision that is detected in the lower retinal quadrants detects the upper field of vision, and that projects on the lower wall of the calcarine sulcus. So anything that becomes, related to vision, if the lower part retinal quadrants detect the upper field of vision, the upper part of the vision which is viewed by the eye, that can be sensed in that sends information to the lower wall of the calcarine sulcus, while the upper retinal quadrants detect the lower field of vision. Basically, the retina is basically divided into four quadrants: left, right, upper, and two lower quadrants are left and right. So the upper quadrants are basically responsible for detecting the lower fields of vision, whereas the lower quadrants of the retina are responsible for detecting the upper fields of vision. So and the macula, basically the macula, as I told before, is the functional part of the retina, and it also sends its information. It basically sends its information to the Brodmann area 17, and the periphery of the retina, which senses vision, sends its information to the anterior part, to the Brodmann area 17. So this was about the optic nerve and its course, as well as the binocular vision. Thank you so much.